Southgate here from Pilates Therapy. Today I'm going to show you a screen for the knee. I'll show you actually screens for two ligaments that you can do really easily together. It is the anterior and posterior drawer test, and it is looking at the posterior and anterior cruciate ligament. I will start with, so my daughter here is kindly made herself available, but she is having a bit of knee pain in her right knee, and amongst other tests and screens, because she had a little event, we are going to look at her ligaments. So we're starting with the posterior and anterior cruciate ligament. I'm going to start with her good leg first. So we're going to take her leg and just bend it to a 45-degree angle. I'm now going to sit on her leg to stabilize her foot and her leg. I'm going to take my thumbs onto her tibial tuberosity and then hold the back of the tibia, and that way I can move that forwards and backwards in order to test the anterior and the posterior cruciate ligament. So I'm going to start with the posterior, because sometimes if there is an issue with that, then it's hard to know whether the anterior test is positive or not. So I'm going to start by drawing her tibial tuberosity towards her and pushing that way. The posterior cruciate ligament stops the tibia from translating in a posterior direction. And now I'm going to do the opposite, and I'm going to draw the tibia towards me, and that would be testing the anterior cruciate ligament. So if she was positive, I would expect around 6 millimeters of give or movement, or a really soft, spongy end feel. But this, she feels quite good. That's a good knee, nice and stable. So we'll come over here. It's the cruciate ligament, especially the anterior cruciate ligament, is something that is quite commonly injured in people, and it can be really useful to know where they're at with that. Because if they're positive, we need to do either hamstring or quadricep exercises to help stabilize that tibia bone, and then talk about as well how she straightens and bends her knee, because we've got the mechanics of the movement of the femur with the tibial bone, and there is a motion in which they should move when they bend and straighten, which we talk more about on our knee day in Pilates therapy. So I'm going to take this leg again, and I'm going to pop my thumbs on her tibial tuberosity and the hands in back, and I'm gently going to press towards her, and that feels absolutely fine. It feels like the other knee, which she doesn't have pain in, and then I'm going to draw that leg towards me, and again it feels nice and stable, no different to the knee that doesn't have any tenderness or pain. So we now know we can rule out her anterior and her posterior cruciate ligament as having any problems. It's a nice, easy test you can do with your clients, and it gives you really good information. So if you found that interesting, then you can find courses on the knee. We have courses on the knee and the hip and the foot and other bits of the body on www.pilatestherapy.co.uk.